We're gonna go through our surveillance report in a couple of minutes. I do want to say a couple things before we start that. Number one, I think the thing that a lot of people are talking about is the vaccine. The vaccine arrival is really exciting. We talked to Bozeman Health this morning. As of this morning earlier, they had distributed, I think, 932 doses is what they said, and they were planning on getting their entire allocation dispensed by the end of the day today, so that they can set themselves up for that second dose when those folks are ready. There's more coming, and those initial doses, just so people understand, are really designed to protect the people and go to the people who are taking care of all of us when we get sick. So while Bozeman Health is getting those doses, those are doses that are going to the general public, that are going to the hospital settings, so the people that are on the front lines taking care of COVID positive people. Those are people who are front facing, patient facing staff, and that we think that's really appropriate. And we're really glad they're getting that. I'd also say the community as a whole should be proud of the effort that it's undertaken to reduce the spread of the disease. Our case numbers are down, but maybe most importantly, we're seeing hospitalizations are down. Those things are due to the community's shared efforts to reduce spread through things like social distancing, wearing face coverings, staying away from crowds, washing our hands whenever we can, and staying home when we're sick. And during the holiday season, these are reasons for hope, and these are reasons for optimism and to be encouraged. The progress that we're seeing, though, makes it all the more important. And I hope you'll all bring this part of the message really, really forward pretty strongly today, because I think it's really important that we don't waste that shared effort by letting down. Now is not the time to let down our guard. We have months to go before the vaccine is widely available to anybody who wants it. And in too many parts of our country, we're seeing hospitals being overwhelmed by men and women, and by men and women who are seriously sick with the disease. I'll share before we're done here, I'll have Whitney send out a video that the Washington Post put up today on its website from a hospital in California. And I just think it's a good reminder that this pandemic is going to ebb and flow, and we're probably going to see surges again in the future. And we do have months to go before we get to a point where everybody has access to the vaccine. So we're averaging, nationally, we're averaging more than 2,500 COVID cases per day. We're averaging more than 2,500 COVID deaths per day. And in a couple of recent days this week, we had over 3,400 deaths. That's an incredible number of deaths. We need to really be sensitive to that and understand this remains a deadly virus, and thousands of people are dying from this virus every single day in the US. And that trend is likely to continue when we look at the number of cases that we're seeing. Cases generate hospitalizations, hospitalizations generate deaths. And our average number of new cases in the US now is over 200,000, and the death numbers are following that. So I want to use this time to encourage everybody in Gallatin County, residents, visitors, everybody, young, old, rich, poor, everybody. We need your help to continue to slow the spread and save lives. By slowing the spread in the community, it gives us a chance to keep people out of the hospital. It gives us a chance to keep the virus out of nursing homes and assisted living facilities. So the vaccine is allowing us to go on the offensive against the virus, but that effort was going to take months. And while we do that, we need to continue to play defense. And that means avoiding crowds and crowded settings whenever we can. Those crowded settings, really, that face-to-face contact in crowded settings is really what's going to drive this pandemic. We need people to wear face coverings when they're in settings, when they're in the grocery store, when they're in indoor public settings where might not be able to be socially distanced. We need people to continue to stay home if they're sick. And we also need them to be aware that even if they don't feel sick, they might still be spreading the disease, which is why these things are so important, wearing these face coverings. So with that, I hope that we'll send out that link to what's going on and elsewhere in the country, because I think a pretty significant risk is that we stay focused on what's happening here locally, and we forget that we're living in a country that's really struggling against this virus right now. And even as we have the vaccine arriving at hospitals across the country, even as we're locally seeing numbers that are a bit more encouraging, we have to take into account what's happening nationally. And we also have to take into account that some of what we're seeing, a pretty significant amount of what we're seeing, might be is likely due to just where we are on the calendar. We have many fewer MSU students in town, much less testing happening at MSU. We're kind of in the in-between stages of tourist season. We're starting to see the ski crowd come in, but maybe not the numbers that we will later on in the year. Holiday season really is there, but we haven't gotten into even Christmas week yet. So I want people to be encouraged and I want people to be optimistic, but I also want them to be realistic. We have a long way to go. We need everybody to help make sure we're doing everything we can to reduce spread of the disease in the community so that we can protect our hospitals, protect seniors in nursing homes, and protect each other. So with that, I'm going to try and share my screen. Give me 1 second here. Oh, there it is. Got too much stuff open on my, you still hear me? Okay. So this should look familiar to y'all. This is our weekly surveillance report. The first, as usual, the first thing is we're looking at is the 7-day rolling average of COVID-19 cases per 100,000. So expressed as a rate, this isn't the raw number of cases. This is expressed as a number per 100,000. So we can kind of compare ourselves to other counties and other states. Continuing to see significantly fewer cases than we saw in early and mid-November. You can see that particularly sharp drop off right around Thanksgiving, but we haven't rebounded. It's worth noting that the 3 weeks prior to Thanksgiving, it's worth noting that MSU likely has an impact here, and just the season we're in with MSU. Prior to Thanksgiving break, when MSU was in session, we were getting roughly, during those 3 weeks, roughly 26, an average of about 26 cases a day from MSU. That number dropped in the 2 weeks after Thanksgiving to 5 or 6 or 7 cases a day on average. So you're looking at roughly 20, 25 cases a day that are not accounted for, probably because we have fewer people on campus. But that doesn't explain the entirety of the drop off, and neither does Thanksgiving. We are seeing, we think, a decreased amount of spread in the community, and that's due to the actions of the people in the community. That's due to people, I have no doubt that's about people staying, being careful about their interactions, wearing face coverings, doing the things that we know disrupt the spread of the virus. The other thing I would say about this is what is really encouraging and really an indicator that we might be seeing decreased spread in the community is that our hospitalizations are down. I think for the first time in a number of weeks, we have our hospitalizations due to COVID are in the single digits. That is that's a good sign, because normally when people get sick, seriously sick, they go to the hospital. There's not a lot of things that keep them from that. And so they end up in the emergency room and so that's not an indicator that is subject to sort of the noise of some of the other indicators that we have. So that's encouraging, but again, I want to really make sure that we're pairing the encouraging news with the awareness that in many parts of the country, the exact opposite thing is happening, and we're seeing hospitals being overwhelmed. And so we are going to continue to do the things that we need to do to protect our hospitals, to protect our nursing homes. But we're also going to be continuing to watch this. And if the community can keep these numbers going in the right direction, being disciplined now will win us some freedom later. It'll make it easier to send kids back to school, into schools. It'll make it easier to protect seniors in nursing homes. It'll make it easier to do those things later on. Percent positivity, our overall testing numbers are still down since Thanksgiving. That's probably due in part to MSU. There's fewer people being tested at MSU. It may also be in part due we have fewer people getting sick. We still haven't really seen influenza hit Gallatin County, knock on wood. And so it may be that part of what is driving the lower testing numbers is that we have fewer people who are feeling symptoms that need to be tested. Testing time turnaround continues to be pretty good. You can see that early November time period when we were really seeing median times some days exceeding 4, 5, 6 days. That's not the case anymore. We're getting most test results back within 2 days or less. That's good. I mean, that's pretty important for our overall response. It's important to our ability to keep schools operating, to get people to understand whether they have the disease and know if they don't, get them back to work, get them back to school if they're feeling okay. This shows sort of the number of days from specimen collection to the date received by public health. It's kind of another way to measure testing turnaround time. Again, we like to see that column in 1 be the tallest column. That's what we're seeing right now. And we don't like to see, days 4, 5, and 6 having a significant number of lab test results. So that seems to be headed in the right direction. But again, we're seeing a significantly lower number of testing demand in the county, probably related to MSU and also the fact that people may not be feeling sick and they may not feel like they need testing. Again, we're having a little bit with these lower numbers. We feel better able to deal with contact tracing. We're not yet to that threshold level that we'd like to be at where we can really dive into every case in a really detailed way, but it's much better to have, an average of where we're at. We're at 46 cases a day on average now. That's way better than having over 100 or 150 as we were several weeks ago. Onset date, you can see that period of time in early November this is data from when we interview cases and ask them when they started feeling sick. So a little bit truer indicator of when people were actually feeling symptoms and getting sick. And in this, we're seeing a smaller number of people who are reporting, or a smaller number of cases. And so we're seeing fewer people who are reporting those symptoms. That's a pretty classic epidemiological curve. We hope that continues. I do think we all expect this is going to turn around eventually. We've got several months to go. We've got uncontrolled spread in other parts of the country. We should expect that this may rebound here locally in the future. And then this is our age breakdown. You've seen this before. It doesn't look much different. We still continue to see significant number of cases in the 20 to 29 age category. And then as you get older, you see fewer and fewer cases, probably due to activity, probably due to human behavior. Younger people tend to be out in the community more working. They tend to be have kids. They tend to be in having to deliver kids to schools, and then the really young people tend to be out socializing a little bit more, I think. And so we're continuing to see that growth. MSU numbers, as you would expect, are down very significantly during the winter break. Can you see my cursor? You can see Thanksgiving week is a bit of an anomaly, but you can see the 3 weeks prior to Thanksgiving, we were averaging, between 200 and 265 cases a week. That was, roughly 25, 26 cases a day. That's down pretty significantly. And testing overall is down pretty significantly just because there's fewer people on campus. And then we're continuing to work with a wide array of schools. We have active cases in a high number of schools. We have active cases in a significant number of long-term care facilities. We're continuing to work with our partners in both of those areas. Speaking of long-term care facilities, our staff has really been able to bear down on some of the planning that's happening at the state level to use some of the commercial pharmacy providers to provide vaccine in those assisted living centers and nursing homes. We were able to go in and verify that all the assisted living centers and nursing homes in Gallatin County are on that list. They're in the plans and that they should be receiving vaccine when it arrives. I'm not sure when that's going to be. There's still a lot of unknowns around that, but that's good news. If we can get vaccine into all of our long-term care facilities, that goes a long way. And then as you would expect, with the lower number of COVID cases, we're seeing, occupancy in critical care, down to 75%. That's pretty normal, I think. And then non-critical care beds is pretty comparable. That can turn around pretty quickly. But talking to the folks at Bozeman Health this morning, both in their incident command and in the ER, I heard a really strong sense of optimism and encouragement and excitement that they're able to kind of take the offensive against this virus and start giving those vaccines. Can you all still hear me? Okay. So with that, I'm happy to take some questions if anybody has them.
Hey, Matt, just before you take questions, Lauren Brendel from Bozeman Health was on here on the call, and she just wanted to clarify some just information about vaccine distribution on Bozeman Health's end. So I'll let Lauren speak about what she wants to talk about. So
take it away.
Hi, everyone. Happy Friday. Just wanted to echo what Matt shared at the beginning, that Bozeman Health has received just that initial allocation of 975 doses at this point. It is anticipated that we will finish administration of all of those doses by the end of day today. And we're optimistic that we'll get that next shipment of 975 doses next week so that we can continue vaccinating our employees throughout the health system. I do want to clarify, though, that, and I think Matt mentioned this, that those vaccines have not yet been released for the general public. And so they are exclusively focused on employees within the health system and making sure that we get those frontline workers vaccinated if they so choose as quickly as possible. So just wanted to reiterate that and that we look forward to hopefully in the next few months having that released for the general public.
All right, thanks, Lauren. And okay, now you guys can ask questions, and Lauren's available to answer any Bozeman Health questions you may have as well. So.
Hey, can you guys hear me okay?
Yeah.
Hey, this is Holly Michaels with Lee Newspapers, and this question might be best directed, I think, toward Lauren. I know you said you're optimistic about getting the next shipment of doses within the next week. I am wondering, with the information the state announced last night and today about the reduction in doses that they're expecting, if that's expected to affect Bozeman Health, or if you think you'll still be able to give everyone who got that first shot the next one within that 21-day window.
So the shipment that we are expecting next week would be a continuation of that initial first dose. We are not yet receiving that second dose. And my understanding is that we will receive that closer to that 21-day time frame.
Yeah, and my understanding is that they're being pretty careful on how they allocate to make sure that they're holding back the second doses so that they're pretty sure that they're going to be able to follow through those first doses with the second doses. So my understanding is it'll mostly, if there are reductions, it'll mostly impact us in our ability to vaccinate a new group rather than the ability to follow up on the second dose for the groups that have gotten it already.
Yes.
Awesome. And do you have an idea? I know St. Peter's Health here in Helena in a call earlier said about 70% of their employees were willing to be vaccinated. Do you have a figure for that for Bozeman Health?
I do not have a figure for that. I can do some research and get back to you on that. And this is Holly.
Yeah, it is.
Yeah.
Thank you so
Okay.
much. I appreciate that.
Sure.
I might be able to help you out with that a
Awesome.
little bit, Lauren. We had a conversation with Kelley this morning, and we talked about, I asked a similar question, and one of the things that we heard from Bozeman Health was that there were people who were declining. There's relatively small number of people declining the vaccine, but they were doing it for a lot of different diverse reasons. There's some people who may have had the disease in the past. There's some people who really wanted it to go to other people in the organization. There are people who felt like they could wait, and there maybe is some people that were pregnant or that had medical reasons to decline it. So there had been some of that, but not a lot. And some of the reasons were pretty diverse from what I was hearing.
Yep. And if people are choosing to defer it now, we are reminding folks that they still have the opportunity to get it at a later date. Once, we get additional shipments, or should something in their circumstances change that would allow them to get it sooner rather than later.
Perfect. Thank you, guys.
Thank you. Other questions?
Hey, Matt, I got a question that's relatively unrelated, but related at the same time, since I missed all of last week. Cody with KBZK here. But just following up on the hearing that we have been covering with Rock and R, just walking away from that, what are your reactions from that? What are you feeling coming away from that hearing?
Oh, a relief that it's over, I think. Mostly relief that we can get past that and start focusing on the work, like vaccine distribution, communicating with the public, and doing the things that we want to do. There's no joy in it. There's no victory dance. We're dealing with serious issues here. We're dealing with people who are trying to make a living, and we take that really seriously. I think we're relieved that we were able to get through the hearing. We were able to get the ruling that we got. Now we're going to move ahead, and we're going to keep doing our work, and we remain committed to working with everybody in the community, including the owners of the R Bar, including the owners of bars and restaurants out there. They're a really important part of what we're doing, and they're all, or most of them, including Mr. Hope at the R Bar, I think are trying to do a lot to slow the spread of the disease. So our goal is to move on and to really continue to work with the community, continue to work with bars and restaurants and everybody in the community to find a path through this pandemic that reduces the number of cases, reduces the number of hospitalizations, and reduces the number of deaths.
Answer both of my questions in one pot. Thank you.
Yeah. So I want a couple of things I want to talk to you about related to vaccine distribution. I'm glad that Lauren was able to clarify some of we're getting quite a few calls from people who are eager for the vaccine. We totally understand that. We really have a fairly limited number of doses in Montana and in Gallatin County, and those are really going to the highest risk settings. So healthcare providers and hospitals that are serving COVID patients. And then the next group is going to be nursing homes, assisted living facilities. Really get those providers and the residents in those nursing homes vaccinated. It'll be really important. We're also at the county level preparing for the day when we have more doses to administer, and we're really trying to prepare to be able to get those out. Really doing and making sure we're thinking through three things. We want to make sure we're being timely and efficient. We want to get them out as quickly as we can. we're determined to be safe about it and make sure that we're planning this in a way that's safe. We're maintaining the vaccine. We also want to be transparent about it. We want to make sure that what we're doing, we're sharing with the community. The community understands the rationale. And kind of in that vein, we're next week we'll probably talk in more detail, but we're really looking to get put together, and we're working right now to put together a community advisory group that really is from across the community, a lot of different sectors, a lot of different geographic representation, because I think there's going to be some tough decisions and some need to explain to the community. We want to make sure the community is involved in that. So we've reached out to some close partners, and we'll be talking more about how we're going to do that and who's going to work on that. But I want the community to understand that, in working on this, we've reached out to do things like that, to really broaden transparency, to really help people understand how we're making those decisions. And we've also reached out to partners out there who, our Director of Emergency Management Services, who's here, Patrick Lonergan, as well as Deputy Fire Chief Mike Multiverne, are taking turns with our incident command. That frees me up a little bit to deal with things like the court hearing and to communicate with all of you and to do some of the things that are we need more help, frankly, and we're getting it. We're getting great partnership. We've identified a facility at the fairgrounds that we think will enable us to spread out and be able to administer vaccines when we have them. We're looking at ways that we can also provide and administer vaccines across other locations in the county, all the way from West Yellowstone up to Three Forks, Manhattan, Belgrade, and Bozeman, you name it. So that work is ongoing. What we lack now is the vaccine. We also lack information, and that's just understandable. The federal government and the pharmaceutical companies are trying to get that vaccine out as quickly as possible. But that leaves some level of information blindness that we all have to just kind of operate through. We have to make projections. We have to prepare without perfect information, which we're frankly pretty used to at this point in time. But I want the community to know that we're engaging partners across the community, and that our intention is to administer these vaccines as quickly, as safely, and as transparently as we can once they do arrive. Patrick, did you have anything to add to that?
Not specifically to that. However, I do have something that might be a little bit of an update based on some of the questions folks have been asking. So about an hour ago, the governor's office put out a press release, and I doubt Matt's seen it yet, talking to the next 2 shipments coming into the state. I know there's some questions about that. Some of you probably have the release, but according to that, they do expect the next shipment of Pfizer of 6,825 doses to start going to long-term care facilities through those contracts with CVS and Walgreens and Big Sam Managed Care, to reduction over the initial anticipated doses. Obviously, we don't know how many of those doses, if any, will come to our long-term care facilities here in Gallatin County. That's a total allocation to the state. And then it also does say that they expect to still receive a little over 18,000 doses of Moderna next week, and that those doses of vaccine will go to critical access hospitals and community health centers across the state. So a little update there.
Thank you, Patrick. Yeah, this is fast. This is really fluid. This is changing by the day. We get news about vaccine approvals, and we get news about distribution. So, we might even, at some point in time, find ways to step up the tempo of our information sharing related to vaccine if it gets to be if the pace of information becomes rapid enough that we want to make sure we're communicating. Any other questions out there? Okay, I want to thank everybody again for being with us. Again, I want to stress that there is reason for hope. There's a path to the end, but we've got several months to go, and we really need people to continue to help us reduce spread so we can stay out of the situation that we're seeing in other parts of the country, like California right now. And I would urge you, I saw that Whitney posted the link to the Washington Post video. I think it's important that we contextualize where we are. And there's some good news. There's some good news here in Gallatin County. But our fellow Americans are struggling in many parts of the country. And I want people to continue to be aware of that and to continue to help us avoid getting in that situation ourselves. So with that, I'll end things up, and I appreciate all of you, and I hope you all stay safe and healthy.
Thanks, Matt.
Thanks, Brandon. Appreciate you.